Hi guys, Dr. Rodney White here with another episode of the Sarpy Chiropractic Vlog. Over the last few months, more so than normal, myself and Dr. Brazza have been asked the question, should I get surgery for a disc injury in my low back or my neck? It's quite a complex question and there's a lot of factors that go into it. So I want to try and help give you a guideline of how you should be managing a disc and what questions you should be asking of your doctor, chiropractor, surgeon. First of all, most disc injuries are going to be a disc bulge rather than a herniation. If you're ever told you have a disc bulge, I can tell you 100% do not get surgery on it. It can be managed with conservative care, meaning chiropractic, PT, rehab, ice, all of those kind of things. Now, a disc herniation, on the other hand, can sometimes require surgery, although the percentage that needs surgery is very, very small compared to what actually gets surgery. I've read in some cases that 90% of disc surgery shouldn't be done. In the office here, the problem that we see is most of the time that surgery is done on a disc, that person might get improvement of symptoms for quite a while, maybe months or years. But sometime down the track, they usually end up seeing someone like us with either the same pain or a different but chronic pain kicking in, and they come in here frustrated because the surgery didn't fix what it was meant to fix. So first of all, when you have a disc herniation, almost 100% of the time, you have to have something in the mechanics of your spine be faulty as well. So the disc itself alone isn't the only problem. And when they go in and do surgery and shave off the disc or do a fusion or anything like that, you're not correcting the faulty mechanics that were behind it. So you have to correct that. What a lot of research is showing, especially one of the biggest names in the rehab world is Dr. Liebenson. He's shown that you should do 6 to 8 weeks of conservative care before even getting an MRI for a disc injury anyway. And that's 6 to 8 weeks of chiropractic and physical therapy rehab 3 to 4 times a week, because not only will that help the symptoms, it's your best chance of stopping the thing from coming back again. Now, after 8 weeks, if you're not getting any resolution, sure, that's the time to get an MRI and at least be considering more invasive options like injections or surgery. Still doesn't mean you'll need them, but it's time to at least bring that into the picture. Now, the small percentage of people who really should be getting surgery, what does that look like? Basically, we call it anyone who's getting progressive hard neurological signs. Soft signs are pain, numbness, tingling, burning, those kind of things. If you have a low back pain with sciatic pain and you find that your muscles are shrinking, you're getting progressive weakness, meaning you trip over your foot because you can't lift it, or the big emergency, you've lost control over bowel or bladder, sure, you need to be getting surgery almost certainly, or at least getting a consult. Anything outside of that, in my personal opinion, I wouldn't let anyone near you with a scalpel until you've tried absolutely everything else, because once you've had surgery and all that scar tissue is in there, you're much harder for a chiropractor or anyone else to get right later on down the track when it inevitably blows up again. So hopefully that helps. Share this with anyone who needs to see it. If you have any more in-depth questions, please leave a comment below and we'll answer as best we can. And don't forget to hit the like buttons and subscribe to our YouTube channel. That's our perspective on disc injuries, and have a great day.